My name is Ramon Franco Jr., and I am a laryngologist here at Mass Eye and Ear. I'm the previous director of the Division of Laryngology and the medical director for the Voice and Speech Laboratory. I attended the Pennsylvania State University Hershey Medical Center for my medical school education. This was followed by my residency in otolaryngology at the State University of New York at Brooklyn program. Finally, I did my laryngology program here at the Mass Eye and Ear Harvard Medical School. As a member of the Division of Laryngology, I take care of patients with voice disorders, patients who have neurological diseases that affect the voice, patients with airway stenosis or narrowing of the airway, and patients with cancer affecting the voice box. Aside from my clinical interests, my research interests really delve into the molecular basis for patients who have idiopathic subglottic stenosis, as well as creating new treatment paradigms for those patients that are non-surgical. About 14 years ago, we created a new technique treating patients with idiopathic subglottic stenosis using serial intralesional steroid injections to obviate the need for surgery. Throughout my career here at Mass Eye and Ear, I've pioneered several techniques, taking things that normally are done in the operating room and bringing them to the clinic setting. The first was using a pulsed angiolytic laser called the pulsed dye laser in order to treat patients in the office who have papillomatosis and leukoplakia. I was the first person to do this in the awake setting. We've also pioneered techniques such as aminolevulinic acid photodynamic therapy for patients who have white patches that don't tend to respond to other things. The most recent was creating a technique where we could treat patients with idiopathic subglottic stenosis in the office using serial intralesional steroid injections. My original interest in otolaryngology comes from my father, who was an otolaryngologist. Some of my earliest memories in medicine were with my father when he was on call or going to the hospital for other reasons. I chose laryngology due to my grandfather, who was a famous singer. I wanted to be able to bring high-level laryngology to not only singers, but anyone who uses their voices professionally.